Mukesh Kapila is an emeritus professor of global health and humanitarian affairs in the University of Manchester. He is also the former director for emergency response at the WHO. He joins us from Geneva. So Mukesh, are there valuable lessons that you think have been learned from this pandemic that give you some hope for how perhaps future pandemics will be handled?
Certainly, the coronavirus has taught us a great deal. For example, on the importance of surveillance systems so that countries can novel bugs that might arise. And of course, communications across borders because diseases don't stop there. And that requires real-time capacity in countries and real-time cooperation among nations. And unfortunately, that's something very much work in progress still.
Yeah, and when we talk about transparency, it's a difficult one because we know many nations around the world are transparent at the moment in virtually nothing. However, when it comes to a pandemic, it seems that they have almost nothing to lose to be transparent because of how it can benefit them ultimately and also necessitate help from outside that could be badly needed. So do you see a pandemic or any global health emergency being one way we can sort of bypass that wall of a lack of transparency in places, for example, like China?
The problem is that, and I saw this for myself earlier on when I was in West Africa dealing with Ebola, is that when a country declares that it has an outbreak of a serious disease, and poses a risk to its neighborhood, region, and maybe even the world reacts by closing borders, by imposing other restrictions on the affected country. And all that is a disincentive for countries to be open and transparent. So it affects tourism, it affects trade. And as we've seen now with the COVID pandemic and the restrictions that are in place, which despite those restrictions, the pandemic has basically spread everywhere in the world. So I think before global cooperation can become more effective, some of the disincentives have to be removed, whereby countries should not fear being able to report the emergence of diseases. And that, I think, in the current pandemic discussions that are going on a new treaty and other measures, I don't see that yet being taken into consideration.
Agreed, because it's, it turns into every man for himself when it comes to economic pressures instead of it just being about human health, which of course is what it should be about. But now we see the WHO calling for something like a global health alert system. Is that realistic? Is that something that you would like to see?
I think a better functioning alert system globally is obviously a good idea. We do have an alert system. After all, this is how we've come to know about the different viruses that have been afflicting us over the last several decades. But there is a kind of dysfunction and disconnect between the different elements of the system. And most important constraint is, of course, the capacity of countries. If, for example, in large swaths of the world, there are no laboratories to detect new viruses, there are no communication systems to actually be able to transmit the information to national health authorities. And then there is no diagnostic and other facilities available. And there's no capacities for early response. That means that a global alert system would be fine as an academic exercise. But unless it is incentivized with practical help to countries that are affected by new organisms, I'm not sure it's going to go anywhere.
Yeah, I know. It's disturbing to see how poorly humanity can coordinate, even still, with all of our technology. But Mukesh, it's always good to speak to a voice of reason. Thanks for being with us.
Thank you.